Hello, welcome to a new video. Today I want to talk to you about a problem I see most years when showing horses. Laminitis. If you're looking at going into farrier yourself, this is definitely something you need to be aware of. And if you're a horse owner or work with horses, it's really important that you know about laminitis and how you can help prevent it. If you watch my video where I shod Winnie, you'll know that she had suffered from this condition about a year before filming and is now on the road to recovery. If you haven't seen that video yet, you can click here. Let's go. Laminitis is a disease where sensitive tissue in the feet are starved of oxygen and nutrients. This tissue is known as the lamina, which is what gives the disease its name. It causes them to inflame, but because the hoof has a solid structure, there is no effort to swell. So as you can imagine, this causes the poor horse a lot of pain. It affects about 1 in 10 horses each year, and it can come on very quickly in some cases. It may cause permanent damage to the horse's feet, and it is potentially fatal. There are 3 stages of laminitis: subclinical, acute, and chronic. So that's what laminitis is. Let's look at what the possible causes are. Diet and nutrition. Feasting on lush spring grass or high starch grains can overload the digestive system, which create toxins disrupting blood flow to the feet. Obesity. Weight can be a large contributing factor. In fact, overweight horses are twice as likely to suffer from laminitis as extra strain is placed on their hooves. Overwork. Putting too much strain on a particular hoof can cause laminitis. This might be through fast or prolonged work on hard surfaces, injuries to the opposite limb, which results in overloading of the less painful hoof. Inflammatory elements can also cause laminitis. These include colic, diarrhea, severe pneumonia, retained placenta in mares known as toxemia, equine Cushing's disease, and equine metabolic syndrome. Other issues. There are plenty of other factors to consider that may contribute to the cause of laminitis. Factors like hoof imbalance, previous bouts of laminitis, stress and concussion. Laminitis can be hard to spot, and the symptoms can often be attributed to different conditions. In the subclinical stage, it can be particularly hard to identify laminitis. The symptoms will help to form a picture, but of course, the first step must be to call your equine vet to make an expert assessment. If you notice your horse shifting its weight from hoof to hoof, it may be laminitis. This is more pronounced when the horse starts to lean back on its hind feet, because laminitis is more typically seen in forefeet. Reluctance to move or turn, and lameness. The horse might be less keen to move around than normal, or even present as lame, and will probably become quite stubborn when you try to lead it. This is because it's so painful to move. Okay. You might also notice that the horse's feet are warm. This is not particularly unusual, but if they're still hot after 2 hours, it would suggest something more serious like laminitis. A later stage symptom may be changes to the appearance of the hoof wall, such as rings around the hoof wall, a groove or indent just above the coronet band, or crescent-shaped bruising on the sole, and in very extreme cases, the pedal bone may penetrate the sole. These are some of the possible symptoms of laminitis, but it is possible that their causes might be different. The important thing to do is to build a picture, and if you think your horse has laminitis, contact your equine vet, because laminitis is an emergency condition. Well, that is all a bit bleak, but laminitis is often treatable, and in my experience, most horses make a full recovery, especially if it's discovered early. And so I think we should round off this video by thinking about how we treat horses with laminitis. Obviously, the first thing to do is to call your vet. I might have said that once or twice already. It's important to remove anything that might be causing the laminitis. For example, if they've been gorging on lovely springtime meadow grass, it might be necessary to bring them in. Your vets may also prescribe a course of anti-inflammatories and painkillers. This will reduce the inflammation and pain in the hoof. The horse's diet should also be considered. I've already mentioned how overweight horses are at greater risk, so addressing what they're consuming will alleviate the risk. Hoof care is a crucial part of the treatment of a laminitic horse. The vet will work closely with the farrier to trim and apply therapeutic shoes like this one here, which will aid recovery and minimise pain. Perhaps the hardest stage is rest. The horse will likely need box rest with a lot of bedding to cushion the hooves. Horses are usually encouraged to lay down as they recover. Throughout this whole process, it's important to actively monitor the horse to make sure it is continuing to recover well. The horse will need regular checkups from the vet and farrier, but of course, you should keep your eyes open to any changes that you notice. Winnie is getting over her bout of laminitis well. At some point, I'll do another shoeing video with her so you can see the progress she's continuing to make. Her owner spotted the laminitis early and alerted the vet. Typically, I'm able to work closely with the vet and owners to make sure horses get the right farriery care and treatment needed to make a full recovery. I'm going to leave a couple of links in the description to some sites with helpful information about laminitis. Check them out. And don't forget to also like and subscribe to my channel. Leave a comment and let me know what other equine care topics you'd like me to cover from my perspective as a farrier. Bye!